Hello, dear friends. How are you doing today? I hope you are doing well. Welcome to a new question of dermatology. Which one of the following statements regarding scabies is false? This question is asking about the false choice about scabies. Okay. A. All members of the household should be treated. This one is correct about scabies. All members of the household with scabies infection should be treated. B. Typically affects the fingers, interdigital webs, and flexor aspects of the wrist in adults. This one is correct. Scabies typically affects the fingers, interdigital webs, and flexor aspects of the wrist in adults. C. Scabies causes a delayed type 4 hypersensitivity reaction. This one is also correct. D. Patients who complain of pruritus 4 weeks following treatment should be retreated. This one is false because the patients can complain of pruritus 4 weeks following treatment. Okay. And malathion is suitable for the eradication of scabies. This one is also correct. Malathion is suitable for the eradication of scabies. Okay, and we said that the false answer is patients who complain of pruritus 4 weeks following treatment should be retreated. This one is the false answer. Okay. Explanation. It is normal for pruritus to persist for up to 4 to 6 weeks post eradication of scabies, and this one is important if the patient received therapy for treatment of scabies and is complaining that after 4 to 6 weeks he or she still is experiencing pruritus. We must say that it's normal. It's normal for pruritus to persist for up to 4 to 6 weeks post eradication of scabies. Okay, scabies. Scabies is caused by the mite Sarcoptes Scabiei and is spread by prolonged skin contact. It typically affects children and young adults. Okay, the scabies mite burrows into the skin, laying its eggs in the stratum corneum. The intense pruritus associated with scabies is due to a delayed type 4 hypersensitivity reaction to mites or eggs, which occurs about 30 days after the initial infection. And it's important, as we say, the pruritus associated with scabies is a delayed type 4 hypersensitivity reaction to the mice eggs to the mice or to its eggs, and it's usually happen about 30 days after the initial infection. As we can see here, this parasite is Sarcoptes Scabiei and is making burrow on the skin. After the burrowing on the skin, the parasite puts its eggs under the stratum corneum of the skin, and it lays after 30 days it leads to the pruritus of the skin. Okay, features: widespread pruritus, linear burrows on the side of fingers, interdigital webs, and flexor aspects of the wrist. As we said, the most common site of the burrows of the scabies is fingers, side of fingers, interdigital webs, and flexor aspects of the wrist. Okay, in infants, the face and scalp may also be affected, and it's important in infants we must look the face and scalp, and it's usually can be affected. Secondary features are seen due to scratching, like excoriation and infection. As we can see here in the lateral side and interdigital web of this person, we can see their scars, or we can say that the lesions of their infected skin with Sarcoptes Scabiei. Okay, here we can see under burrows under stratum corneum or under the skin layer of this patient. Here we can see the burrow. Also we can see here the burrow of Sarcoptes Scabiei. Here we can see the involvement of interdigital web of this person. Here we can see in this baby, we can see in this child, we can see involvement of the axillary area. Here we can see their involvement of the pubis area in the patient. Also we can see the foot involvement of this kid and this old man or woman. Okay, as we said, it's usually common in children and in elderly people. Management of Sarcoptes Scabiei. Okay, Permethrin 5% is first line. We must prescribe this one to the whole family. They must use the Permethrin 5% at the same time, all the whole family. Malathion 0.5% is second line, and also if the patient cannot use Permethrin, Malathion 0.5% is a second line. Okay, give appropriate guidance on use. Okay, pruritus persists for up to 4 to 6 weeks post eradication. As we said, it's usually the reaction, the type 4 sensitivity reaction against their mites itself or its eggs. After eradicating the parasite, the body can remain under the skin, and the pruritus for the reaction against the parts of the body of the parasite can be normal during 4 to 6 weeks. Okay, patient guidance on treatment. Avoid close physical contact with others until treatment is complete. All household and close physical contacts should be treated at the same time, even if asymptomatic. All the household people, even if those who are asymptomatic, they must receive the treatment. Malathion or Malathion 0.5%, Permethrin 5%, or Malathion 0.5%. They all must receive at the same time. Launder, iron, or tumble dry clothing, bedding, towels, etc. on the first day of treatment to kill all mice, and this is important. It must be on the first day of treatment for killing the mice. The BNF advises applying the insecticide to all areas, including the face and scalp, in contrary to the manufacturer's recommendation. But patients should be given the following instructions. Okay, apply insecticide, cream, or liquid to cool dry skin. Pay close attention to areas between fingers and toes, under nails, armpit area, creases of the skin such as at the wrist and elbow. Allow to dry and leave on the skin for 8 to 12 hours for Permethrin, or 24 hours for Malathion before washing off. Yeah, and it's important, if the patient is using Permethrin, it must be remain on the skin 8 to 12 hours, and if the patient is using Malathion, it must be remain on the skin for 24 hours for affecting on the parasite. Reapply if insecticide is removed during the treatment period. Example, if the patient wash his or her hands and change a nappy, etc., and the patient must reapply it. The cream or the cream must be must stay on the infected areas for, as we said, if it's Permethrin 8 to 12 hours, and but if it's Malathion, it must be remain for 24 hours on the skin after washing. Before 8 to 12 hours for Permethrin, or before 24 hours for Malathion. If it's washed, we must reapply the cream on the infected sites. Okay, repeat treatment 7 days later, and this is important. We must repeat treatment 7 days later for the mice, for the eggs of the parasite which they are now hatching. We must repeat treatment 7 days later. Crusted or Norwegian scabies. Crusted scabies is seen in patients with suppressed immunity, especially in HIV patients. The crusted skin will be teeming with hundreds of thousands, even millions of organisms. And ivermectin is a treatment of choice, and isolation is essential in these cases. We must note that isolation is really essential because these people are usually immunodeficient and they are teeming with they are involved with hundreds, thousands, and sometimes millions of parasites. And as we said, ivermectin is effective treatment and is choice for the treatment of patients infected with crusted or Norwegian scabies. Okay, here was an explanation about the patient infected with Sarcoptes Scabiei. Thank you for your attention.